Hello everybody, welcome to Dr. Sam's Anatomy classes. In this small presentation, I'm going to tell you how to find the blind spot in your own visual field. I'm Dr. Azmi Mohsen. Now before getting on to the topic, I'm going to revise few important facts about the retina which will help you understand this topic better. So now keep imagining what I'm drawing here. This I have drawn is retina, right? And this I'm seeing from the posterior view. And you know that, we divide this retina into 4 quadrants with the help of these meridians, a vertical and a horizontal meridian into 4 quadrants. And this point, is called the point of, this point in the center is called Fovea centralis. It's the point actually the visual axis strikes. Visual axis is the horizontal axis passing to the center of the pupil, center of the eyelids, and striking back onto this retina. This point is Fovea centralis, the point of clearest, sharpest, three-dimensional colored image, right? But remember, all what you see and you're enjoying this colorful world is only when you're seeing in the bright light outside. Got it? But if there is dark or it is dim light on outside, then your mid-peripheral retina, this portion, this becomes more active in your dark or dim light. Got it? Okay. Now a bit about this fovea centralis. This point here, remember there are 10 layers in the retina, but here the layers are actually less. The reason is the central layers towards the vitreous, they shift out, they swipe peripherally so as to create a depression or the shallowness at this point. And that's why you find only the 4 layers here, right? The photoreceptors actually at this point are basically only cones, and they are aligned obliquely. These photoreceptors are placed obliquely here, and the layer of the 5th layer, the internal plexiform layer, the fibers of these photoreceptors, the axons, they are obliquely, or you can say they are deviating peripherally obliquely so as to create a shallowness here. Got it? Okay, then a little around 3 millimeters medial to this, a little below to this horizontal meridian, here I am drawing it. This point actually, I think I should use a different color. Yes, so this point I have drawn is a point of the exit of the the second order neurons, or you can the third neurons. Second order and third neurons is the same thing. Remember, the axons of the ganglion cells, they form the nerve fibers. They form the optic nerve. So those fibers, they exit from this point, and this point is called the optic disc. Some books they also write is at the head of the optic nerve. And remember that this is not only the exit for the nerves but also for the retinal veins, and it is a point for entry of the retinal arteries as well. Got it? Okay, then about how the nerve fibers exit from this point, because that also is important to understand. So now what I'm drawing is the retina, but this time I'm drawing it, imagine that I'm seeing it from the inside, means the anterior surface of the retina, right? This time I'm showing the anterior surface of the retina. So again, then this point, as I already drawn it here, this will be the fovea centralis, and a little bigger in size than this. Remember, a little bigger in size than this will be the optic disc, the blind spot. Why we call it as a blind spot? Because there's no rods, no cones, no photoreceptors. It's a point of exit of the nerve fibers of the ganglion cell layers. Okay, then here also this meridian system is followed. Let me tell you how these fibers exit out. Look here, the fibers from this, the macular portion, the fibers will exit out right from here to the optic disc like this. These are the macular fibers which will exit out like this. And the peripheral fibers, as I told you, there will be a horizontal meridian here, and this horizontal meridian system will be followed. So that's why the peripheral fibers will now pass, peripherally, and will all converge here on the optic disc. This is how the peripheral fibers, they exit through the retina, right? So this way, and they are strictly following this horizontal meridian rule. So they should not overlap, one thing. And the fibers from the temporal half, you've seen they are following this horizontal meridian, and even on the nasal side of the retina, the fibers actually are converging like here, following the meridian rule, and they will also emerge out from the optic disc. But remember, the peripheral fibers, they are peripherally located in the optic nerve, while the macular fibers, they are centrally placed in the optic nerve. And if you are not aware of this orientation, let me tell you, this is the medial side and this is the lateral side. Okay. So that's how, the fibers emerge out. Now think about, like, if there is an increased intraocular pressure that happens in case of glaucoma, right? So in that case, like, if there is a consistent increase in intraocular pressure, there will be, like, a pressure created at this optic disc, and here also you will have a shallowness, right? And you know that this nerve fibers, they will pass through the choroid, then to the sclera, and that portion is called the cribriform lamina cribrosa, right? So because of increased intraocular pressure, the peripheral fibers, right? So the ganglion cells fibers or the ganglion cells will be damaged sometimes around the periphery of the exit of this optic nerve, and that's why in glaucoma there is sometimes loss in peripheral vision. Got it? So that was about the retina thing. Now let me tell you about the visual fields. Okay, so remember that visual field also is like this. The visual field, like, now this time I'm drawing is the visual field. Sorry, this time I'm drawing is the visual field. But visual field, remember, they are mirror image of the image formed on the retina. So this again has, we divide it into quadrants for the convenience of study, into 4 quadrants. So this portion is supralateral quadrant. This, the image of this will be formed on the inframedial quadrant. This is supramedial quadrant. Image of this will be formed on the infralateral quadrant. This is infralateral quadrant. Image of this will be formed on the supramedial quadrant of the retina. This is inframedial quadrant in the visual field. Image of this will be formed in the supralateral quadrant of the retina, right? Everything you know that. I've already uploaded many lectures on all this. Now, in the visual field also, there will be, it's a mirror image, right? So everything you're seeing on the, outside, the same as it is captured like a camera on the retina. Even a single spot is captured on the retina, right? Or you can say the retina, this is reflected here in the visual field. So that's why, let me tell you that this point again will be the point of the focus or the clearest vision, and you will also have a the blind spot in the field of view. But this time important is the field of view you will find in the lateral side, because now, earlier also I had drawn, I should have mentioned actually the side which I had drawn, that was actually the left side of the retina which I had drawn here. Now this is the left visual field. This is the left visual field, right? So in the left visual field, optic disc will be medial to the fovea in the retina, and here in the visual field this optic disc is lateral and this is medial. Got it now? Okay, so now let's move to the next slide. Okay, now here they have shown is the blind spot in both. I mean this is what I have to show. First of all, understanding of the blind spot in both the visual fields, let's discuss about the visual fields. So they've shown is the color coded thing. You have a binocular vision. For the right eye, they are showing this much portion they have shown is the right visual field, and the blue color code they have shown is the left visual field. Now about the visual field, although this tracing of visual field is precisely done with the help of this procedure called perimetry, but we're not talking about right now that about perimetry. I have already taught you in my previous lectures. What I'm going to tell you here is imagine that this I have drawn is a eye, right? You're seeing the eye from the front. Got it? So when you're seeing in the front, actually your visual axis is this. This is your visual axis. Got it? And when you're focusing at a distant object, right, your field of view on the medial side reaches around to this axis, this much, and this much is around 60 degrees, right? Your medial field of view actually is limited around 60 degrees. Okay. Now you seeing, while you're focusing at a distant object, your lateral field of view extends to this much, and this be 100 degrees. This is around 100 degrees, this much axis. Got it? This is 100 degrees. So that means this much becomes your visual field. This is your visual field when you see it from a horizontal, in the anterior view. Now I'm going to tell you about this upper and lower extent of the visual field, right? So this I've drawn is the eye. Here you have the eyelashes and all, right? So when you and this becomes your axis, right? This is the visual axis, and now your visual field you're seeing with at a distant object, and your upper limit of field of view will be at around this much axis here. Again here it's 60 degrees. So vertically your field is also limited to around 60 degrees, while horizontally or inferiorly your field of view reaches a little more, you can say a little more, and this is around 70 degrees. So your inferior field of view reaches to around 70 degrees. So this much becomes your field of view. Got it? Okay. Now about the MCQ thing. Before, let me tell you why is this restricted on the medial side at around 60 degrees, right? So this is very obvious reason, that here you have the nose and here you have is the nose. So when you have a nose here, obviously you have the nasal bridge, and because of that nasal bridge, here, right, you have a restriction here, and that's how they have shown it here in the diagram. This field of view, you can see this right field of view is restricted to 60 degrees because of this nasal bridge. Similarly, in the left eye, this medial field of view is restricted to 60 degrees because of the nasal bridge. Okay, but you have lateral much freedom, right? The lateral extent they have shown is 95. Let me tell you, you'll find much variations in different books. So always remember a range. It has a lot of individual variations. So remember it's around 95 to or 90, even 95 to 100, a little more than 90 degrees, or maybe 100 degrees in some. So it's always a range in the lateral view. In fact, all the views. But if in case now, what restricts, let's ask, what restricts the superior view then? Why is it limited to 60 degrees? So above you have, remember, the frontal bossing, your forehead, and the superciliary arches, the eyelashes, the eyebrows, right? So because of that, the field of view is limited above. Then what restricts the inferior field of view? And the reason is now you have your cheeks and your lower eyelids and the eyelashes, which also is limiting your lower eye field. But lastly, what you find that the maximum field of view is reaching on the temporal side, because there is no much limitation. Got it now? And that also is important for your awareness, because both your eyes are, this is now a morphological significance, because you're looking both the sides in the front. So you should have been, to make you alert from the surrounding. If somebody is approaching from the periphery on the posterior side, you should at least have this much of vision on the lateral side. Compared to animals, remember, then they have both the eyes placed laterally, and that's why in animals the field of vision is much more. They have much more lateral field of vision. But in contrast to animals, in humans you have more amount of binocular vision. Got it? And what is binocular vision? Now look here, binocular vision is this vision. The overlapping of the two visual fields makes this binocular vision. And this field, they have like this overlapping. So because of this overlapping, you have much more clear image. While in animals, they have very less of binocular, overlapping of the visual fields, because both the eyes are placed laterally. In aves, in birds, like, in reptiles and in other mammals, they are mostly laterally placed. Dogs, cats, buffaloes, right? So the frontal field of view is less. Overlapping this binocular vision is less. Anyways, now this much portion remaining in our field is monocular on the two temporal sides. Now I will just focus upon the blind spot in the visual field. We are slowly coming to the point of the topic we have to discuss. Let's talk about the blind spot. Now this is the visual field, the red color one we are talking. Now let's draw it. I'm drawing here is the visual axis. Let's say this is the axis or the median plane. So will this be medially 15 degrees, the blind spot from here, and blind spot from here of the left eye will be this 15 degrees? No. I have purposely drawn it to make you correct this, that this 15 degrees is not the measurement from the median plane. So let's correct this. This 15 degrees is basically from the visual axis of the right eye and the visual axis of the left eye. Clear? So from the right eye, when you see in the front at around 15 degrees temporally, you will find that there is a blind spot. Of course, you will not find it, but this will be, this can be found out with the help of perimetry. Right? That's a procedure of finding out the visual field. There you can find this blind spot. Now in this left eye, again, this is the visual axis. So 15 degrees temporally, you find there's a blind spot in the visual field. And this blind spot is actually, scotoma is actually any blind spot in the visual field. But this one is a physiological blind spot. Means what? It's present in every individual. Got it? So 15 degrees temporal to your visual axis in the visual field, you find a physiological scotoma, and that is called blind spot. Got it? Okay. So now how to find this blind spot in your visual field? Let me tell you one more thing, that why actually, before going into this demonstration of visual, blind spot in your visual field, let me ask you, why is this we don't see this blind spot in our regular life when we're seeing both the eyes? So now look here. As I told you, this blind spot is a blind spot of the right eye, right? This one. But this much field, blind spot is this one, and this one, the left eye, the visual field of the left eye, this point will be striking on the left eye as well, right? And there it will, it will strike the normal retina, right? So there will be an image formed on the left side. So that's why in binocular vision, this blind spot will not be seen because of the vision formed on the opposite eye, and there will be a picture created. So that's why in binocular vision you will not see. Similarly, if let's say this is a blind spot which you of the image of the optic disc here. So this actually is a blind spot for the left eye, but you will not see in a binocular vision. Why? Because this is forming an image on the opposite eye also. Got it? So because of this binocular vision, you don't find a visual spot when you are seeing with your both the eyes. Got it? Now let's talk why you don't find a blind spot in a monocular vision. Let's say that this eye is blinded. Right? We are seeing only from the right eye. When you're seeing only from the right eye, the red color zone is the visual field. And now this blind spot should be formed in this field. Why don't we find a blind spot in monocular vision? This you have to understand. This is important. Actually, now what happens, remember I have taught you about the retina. So the a 0.3 millimeter medial to the fovea centralis, the optic disc, from the nerve fibers were emerging, right? The second order nerve, the third neurons, and they were forming the optic nerve. So you don't have any photoreceptors there. Now the same everything, this is called that's called retinotopic representation of the images on the retina, or as it is, transported via this, geniculate pathway, and they're all, submitted or represented on the calcarine sulcus. And calcarine sulcus, it's a complete sulcus on the medial aspect of the occipital lobe, and above to that is cingulate gyrus, below to that is the lingual gyrus. So the fibers from the upper half of the retina, they project the image in the cuneus portion of the calcarine sulcus, upper portion, while the fibers carrying visual impulses from the lower half of the retina, they project their fibers onto the lower surface of calcarine sulcus, and that's part of the lingual gyrus. Got it? However, the macular fibers, they project, they have a larger representation, and they reach more posteriorly, and even this calcarine sulcus pushes on the superolateral sulcus in the form of post calcarine sulcus, and that's an example of axial sulcus. Got it? Okay, then because the images, each and every point in the visual field on, and even in the retina as it is projected on the occipital cortex, then that means this image is formed at the optic disc. That area is also represented in the occipital cortex. So why don't we see a blind spot in a monocular vision? Now the reason is the area that's, the area of the blind spot that's represented in the calcarine sulcus, right? So why don't we see it in the visual field? So the reason is that our brain typically fills up the blind spot with the information we need based on the images surrounding the blind spot, right? So the images formed in the visual cortex surrounding to the area of the blind spot, those images, our mind perceive them and fill this gap of blind spot in the visual field. That's what is normally happening. But it doesn't mean that this gets disappeared. You can find it experimentally. That's with the help of perimetry. Got it? And if you're not, that's not available everywhere. So that's why I have demonstrated this in my small little video so that you can check this out, blind spot in your own visual field. Okay, so now you're going to see this demonstration. Okay, now I'm going to demonstrate how to find a blind spot in your own visual field, right? So this is a small experiment which everybody of you can do it at your home. You just have to draw a point somewhere on the wall at a distance of, when you're sitting on the floor, that would be the same height from your at the equal level of your eyes, right? So they have drawn this point on the wall, and my subject here is my student. She is sitting around
at a distance of around more than 6 meters, right? So now I've instructed her to keep focusing on the same point on the wall, and she's asked to close one eye. Now can you close one eye? Okay, good. Now she is with the right eye open. Can you see, with the right eye open, she is focusing the same point. And once again I'm going to show you here the same point here. This is the point I've drawn. So she'll focus there on the same point with one eye closed and the right eye open. Now there's a there's a visual axis formed between the point and her right eye. This should not be disturbed. Continuously she should make a constant gaze on that point, right? Now I'll ask her to raise her finger with the right hand in between, bring this finger in between the visual axis from your right eye to this object on the wall at a distance of around 30 centimeter or 1 feet. But the thing is, she should not focus on the tip of the finger. The tip of finger actually should cover the spot. The tip of the finger she's introduced, she should cover the object, that the point I've drawn. So that finger is introduced in between. Now I'll ask her to keep her focus on the wall, and slightly move her finger in the same equatorial plane laterally, temporally. Okay, start moving your finger laterally, and at one point when she'll move her finger laterally, slowly she will find that her finger or the tip of the finger has disappeared. Yes? Your finger has disappeared at this point? Let's see if it's from the center. So can you see now her point? She's pointing around an angle of 15 degrees from the visual axis. That means she is still continuously glaring here, focusing here on this point that I've drawn here. But the focus is on the wall, but this finger is at around 15 degrees from the visual axis, and at this point she is not able to see the tip of the finger. Can you move it still laterally?
Yes, sir. Now I see.
Now you are?
I'm able to see.
Okay, now she is able to see again. She is again able to see her finger. And again bring it medially, slowly. So again she has lost the vision of the tip of the finger at around 15 degrees. Again you bring it in the principal axis.
Now I see.
Okay, so she can see that the tip of the finger is visible. So got it now? So this is how I think it's easy. You all can practice at home, that you can find the visual field, the blind spot in your own visual field. So there you find she's again doing the same thing. See, at 15 degrees she cannot see the tip of the finger. This everybody can do it at home. Okay, done.
So I hope you've understood how to find the blind spot in your own visual field. Got it? And this is what I was demonstrating, that this is the eyeball, this is the visual field. Now you've understood that the images from the blind spot from this area, a little lateral to the center of the visual field, the blind spot, and that is the physiological scotoma, and the images are formed at the optic disc. That's why it's being a mirror image. The coordinates in the visual field are the opposite of the coordinates in the retina. Got it? So the optic disc is represented laterally in the visual field, and that's the point of physiological scotoma, or the blind spot in the visual field. I hope you've understood it. Okay, thank you. That's done.